I'm Lou, for those of you who don't know me. I'm a GP at Pittsmore Surgery, and I'm also a health inclusion champion, and I work with SWAP as a GP there.
And hi, I'm Katie Bain. I'm one of the outreach workers with SWAP, involved in van and sauna outreach. My background is as a nurse. I worked in sexual health for about 14 years, and I'm also a psychosexual therapist working over at Portsbrook.
So we're going to do a 20-minute session and then hopefully 10 minutes Q&A if we get the timing right, to give you an overview about sex work or prostitution. We'll talk a little bit about the organisation that we work with, SWAP, and the local picture, some stuff around the barriers to accessing care for this client group and best practices, and then, as I say, hopefully Q&A at the end. And we possibly don't need to go through ground rules, but just for the sake of it, hopefully we'll finish on time. I know we're going to get cut off if we don't anyway. We will go through some questions at the end, or like previous sessions, I think if you put questions in the chat and we're out of time, we will deal with them on email and get back to you. I'm hoping that this will be open and respectful, and anything that's discussed would stay confidential within the group. And we're really open to some feedback, either at the end of the session or afterwards via email. As I say, it's going to be a little bit tricky because we can't hear any of you, but we will be keeping an eye on the chat.
Okay, so I thought, we thought it'd be really helpful just to go through a little bit of the detail around SWAP. So SWAP is the Sheffield Working Women's Opportunities Project. It's been around for just around 30 years now. It started off as the Prostitutes' Rights Advice and Information Service that actually originally got funding from the AIDS Education Project. So back in the day, basically SWAP revolved around giving support and outreach work to women involved in street sex work, and that was initially done with 2 workers in a car driving around the traditional beat areas or the red light districts. That initially was around Broome Hall, but slowly over time it's moved. Obviously the work has now expanded massively, and SWAP works with women involved in a range of sex work activities, and we'll talk a little bit more about that later. They have a central office which is above the Wicker Chemist, which is a great location for drop-in, but also the outreach service. So that involves the van that's locally known as the Johnny van, that a lot of the women that we work with know, which goes out on the beat, which is currently around Kelham Island, Neepsend area. In terms of staff mix, there is a manager, deputy manager, crisis support workers, and within the team we now got a drugs worker, a housing worker, and a range of outreach workers. Some are volunteers, some who are paid, and lots of them have relevant professional backgrounds as well.
Okay, so what we'd hoped is that those of you who've got smartphones that can read a QR would be able to access this QR code for us, and if not, you can copy and paste the Menti link in with the code 2156432. We wanted to take a minute, really, not much more, to get you to write down all the different forms of sex work that you can think of, from anything that's on your radar, as vanilla or as kinky, whatever you can come up with. So we'll give you a second or two to kind of use the QR. If you have any problems with it, put something in the chat. If this doesn't work, we'll just kind of take some stuff in the chat. We just thought the Menti is anonymous and people might be happier putting their ideas in there instead. So yeah, if you could give that a go, that'd be great. James, I can only see you in my picture. Can you give me a thumbs up if that Menti's working? Are you able to use it? Oh, brilliant. Okay, we've got some stuff on there. So that's quicker than I thought you were going to be. Well done, guys. You're on it. I have to say, you're much more impressive than the med students. When I ask this question of them, they just go mute and look really embarrassed. Okay, so what have we got on there? You're covering lots of stuff, actually. Yeah. Probably got most of the ones that we're going to go through on our next slide. So, yeah, totally streetwise. Well done, GPs.
Yeah.
Okay. Yeah. Let's see if this works. Don't know if you can see that, but that's what you've all contributed to. And that's the list that we had, so pretty impressive.
Yeah, I think looking at the responses, there's a lot that would match up within here. I'm just looking to see if there's anything separate. I think probably the sugar arrangement, so that's where somebody would have, when we're talking about kind of women, would have a male sugar daddy, and that might be around having contact with that person, whether that's dating, kind of similar to escorting, going out, or sexual arrangements in exchange for either money or goods. So that's on there. I think the other areas are pretty much covered. In terms of kind of, we've got saunas down, also known as brothels or massage parlours. For this talk, and locally we often call them saunas. I don't think there's anything separate there at all, actually. We've got online services, text sex, is webcamming? Yeah, webcams on there. Thank you for the naked butler, whoever popped out on there, so that's great as well. I guess that would predominantly be kind of the gender difference, but they might have, I don't know, naked housekeeper, I guess, as well, potentially. Yeah, that's fine. So we thought kind of it's helpful to think about sex work overall and the hierarchy of sex work, because this can be very relevant to the clients that we're working with. So just an example of the hierarchy of sex work, we might think about high-end escorting, moving through to what we call survival sex. I think it's quite important to recognise that within sex work there are some very marginalised women, and there are also some women who are very much kind of expressing their autonomy in terms of sex work and making choice about what they do, rather than having to make a decision. For example, with survival sex, somebody might be making the decision between shoplifting to get by, get food, versus having sex to get by. Within the kind of hierarchy, I think that there's different terms that are used, but transactional sex, I think, covers all of it, really. There's the exchange of sex for material or financial gains. When we think about survival sex, often we might think about the women on the street who are marginalised, very vulnerable, and that's around having sex to meet immediate needs. What I would say is survival sex is something that can cross over kind of socioeconomic barriers. When we're preparing for this, I came across a report from the Department of Work and Pensions around survival sex and universal credit, because they were realising that the benefit system was potentially a triggering factor for some people having to engage in survival sex. So that would be an example of somebody who's got nowhere to sleep, the benefits haven't been sorted out, so they're having sex in exchange for a bed for the night. The report was really interesting as well, and talking about how people potentially were having sexual exchanges for food shopping, also about supporting their kids with their financial needs. So I think it's one of the areas where it sounds like it might be the most vulnerable people, but actually it can cross other areas as well, and that's something to be mindful, particularly in terms of making assumptions about who our clients are and who we might be seeing who could be engaged in transactional sex or survival sex.
So just a little bit about the kind of the UK picture. We think somewhere between 70,000 and 100,000 sex workers are currently working in the UK. It is a guess because they don't always self-identify, and they certainly don't join in things like the census or an Ipsos or Mori poll, but that's a rough idea. And it's a large part of the UK economy, £5 to £8 billion. In terms of the legalities around sex and sex work, it's different all over the world. You're probably aware there are some countries where it's legal, other countries where it's been decriminalised, and then going right over to countries where it's punishable by death. In the UK, it's a little bit grey, but the exchange of sexual services for money in the UK is legal, other than in Northern Ireland, although there are some activities which are illegal under the Sexual Offences Act. So soliciting on the street, paying for the service of a sex worker, owning or managing a brothel, pimping someone out, and advertising sexual services are all illegal. It varies all over the UK as to how that is kind of implemented by the police and the CPS. And certainly I would say, I don't know if you agree, Katie, within Sheffield, the police are more keen to pursue the guys out there that are buying the sex, or the pimps, the organised crime gangs that are putting the women on the street, than they are prosecuting the women themselves. So there's a kind of more onus on the demand part of it rather than the supply side of the trade.
Yeah, I think just to add on to that, I'd say the local police for a long time, and based on some cases that are in the early 2000s, it's very much around harm reduction, and that is relevant for both women working on the streets, but also the saunas as well. And Sheffield is a little bit unusual as well, so we'll go on to talk a little bit about that as well. So yeah, saunas, otherwise known as brothels in Sheffield, and I didn't realise this until a few years ago. Sheffield is well known for having what they call the sex mile, which is essentially the stripped down Attercliffe area, and that's because of the more obvious kind of sex shops that's there, but there's quite a few of the saunas that are there as well. In other cities, saunas have been shut down completely, but a lot of the saunas in Sheffield have been around for a long time, and the police, as I said before, very much approach it in terms of harm reduction. There are some that openly advertise, and you can Google the saunas in Sheffield. So there's Caesars, there's Diplomat, there's Girlfriend Experience, there's all sorts of ones that you can find, and they have websites that tell you all you need to know. But there are other sex venues that are much more well hidden. So the flats in the residential areas, there might be very few people working there. So yeah, Sheffield is a little bit unusual in terms of the number of saunas and the fact that they haven't been shut down, and there is a bit of a legacy from the early 2000s around that. And there was a case where the police tried to close a sauna down, but the judge threw it out because the police hadn't intervened before, so it was kind of like a double standards type approach to the law and applying it. In terms of the street-based sex work, as I said before, it's around the Neeps End area. For those of you who've been around in Sheffield for a long time, it used to be a Broom Hall, then it was around the old Jessops, moving down Edward Street, further down to sort of Shalesmoor, but I would say it's very much more over in Neeps End, moving up the back of Rutland Road as well. And a lot of that has been about the urban redevelopment, and obviously the visibility there and local residents groups. Obviously it's very difficult for them if they've got a chaotic group of people who are on the streets, and also the associated crime that goes with that. Thinking about the demand in supporting women at the moment, it's high, it's really high actually. So we've put there that it's kind of tripled since 2019. So I think over a comparative 3-month period, SWAP had approximately 200 contacts with women in 2019, but then more recently it was up to nearly 400. So it's a high volume of people and number of contacts that are either accessing the office or the van that we use for outreach as well.
I think I missed that one.
Yeah. So we thought thinking a little bit about kind of barriers that sex workers, and that's thinking across the board, so not necessarily just women involved in street sex work or the more vulnerable and chaotic women, but actually across the board to those who are working in the different areas of sex work, why it might be difficult for people to access support services. And obviously in terms of this kind of session, particularly around primary care and seeing a GP or one of the teams, one of the members of staff within the GP service. So things that seem really key. Something that I'm really focused on is around the issue of stigma and shame and that fear of being judged. So obviously for a lot of the women who are more chaotic, they've got associated issues around and vulnerabilities around their drug use, alcohol use, chaotic lifestyle, and the fear of judgment around that is very high. What I would say is I've worked with women in some of the saunas who are also very mindful of disclosing sex work and are very vigilant to how that is asked if they are working, and also responses to that. So an example a woman gave when I was last doing an outreach session, she had gone to a service and it was around her sexual health, and one of the questions was posed was that you're not a sex worker, are you? So she immediately picked up on, crikey, I can't now say that I am a sex worker, and her fear and her shame stopped her accessing the care that she needed. So, you know, that kind of issue of shame and stigma is really there. And I'd also say it can be there for us as professionals, that shame of, am I going to get this right? Do I know enough? How can I support this person? What's it bringing up for me as well? Yeah, so that's a pretty big area, and I think it cuts across a lot of the women that we work with. Do you want me to carry on? Yeah. Also thinking about kind of background for people, chaotic backgrounds, so having safe and secure accommodation, difficult relationships. So a lot of the women on the street sex work are involved in abusive relationships. 97% of the women accessing SWAP who are working on the street have polydrug use, so crack, heroin, add alcohol and other substances in as well. So very chaotic, not working to the same timelines or same days that we're working to as well. There's a huge amount of trauma in women who are involved in sex work, not just street, but I would also say within the saunas as well. So thinking about trauma-informed approaches, services being accessible, and what that space is like for a woman coming into a service. So SWAP is a female-only space, or for women and people who identify as a woman, but that's very important for people, and often women will comment about male staff and how comfortable they do or don't feel with working with somebody who's male. A lot of the women, again, the more vulnerable women, don't have the access to tech that everybody else does. The amount of women we see on the beat who've had phones, lose phones, swap phones, break phones, need a phone. So given that a lot of access to services and benefits and support is online, that can be a massive challenge.
So thinking about what we can do in primary care to improve kind of our service and the access for this client group, I think time and trust is absolute paramount, and it does take time to build that with these women. They've suffered a lot of stigma, as Katie said, and a lot of trauma, so it's not easy, but this is where trauma-informed care is probably most crucial for groups like this. And we talk about groups that are hard to reach or hard to engage, and I would really challenge that with this group, because we see them on a daily basis at SWAP or at Archer Project or at Fitzwilliam. You know, they are engaging, they are present, but just not with every service. So I think it's about us asking ourselves as service providers, why aren't these women kind of engaging, and what's the barrier to that? I think flexibility is crucial again. So trying to kind of look at things like if they're late for their appointment, you know, are we being really rigid about calling that a DNA and not seeing them? Thinking about the times that we run clinics, where we run them, are they drop-in, are they appointmented? Making sure that we're sending out appointment reminders, being willing to work with their support workers, joining the TAP and the complex case management panels, doing some work outside of the consulting room really with the other services that work with these women to kind of try and make sure that the care's joined up. Obviously, as long as we have consent, but most of the other services will have got consent in terms of sharing health information. I think thinking about things like prescriptions or sick notes, these women don't present asking for something in 7 days' time. They need it now or tomorrow. So again, it's having that flexibility to maybe approach things slightly different with this group. And whilst, yes, having a zero tolerance policy is really important for practices, there is something around the trauma-informed side of care for these women that is about kind of de-escalating, making sure that our staff are trained in some of these skills, and that we're doing our best to kind of preempt any issues. So allowing them to wait outside rather than in a waiting room if that's difficult for them, seeing them either at the end or the beginning of the surgery, again, so that they're not confronted with a really busy, chaotic waiting room, or a safe space where it's a women-only clinic, a women-only waiting room, or a separate waiting room where they'll be able to sit a bit more comfortably. we could probably go on about this for
Yeah.
ages, and I'm just mindful that time is ticking away. I think if you do want to kind of do some reflection on this session, what would be really valuable would be around, you know, are you kind of set up to look after these women? Are you trauma informed? And how could you change the way your surgery runs to try and meet the needs of this group a little bit better? So in terms of what we can offer within our practices, I mean, within 10 minutes, obviously we're limited. We're not going to get them to stop using drugs or to stop sex working, but there is a lot we can do around harm reduction. There's lots of resources available for things like safe drug use, needle exchange, stuff around the STI screening side of things, being safe when they're with punters. There's a lot of information out there. So approaching some of that we can definitely do. I think obviously being non-judgmental and avoiding assumptions is key. It's okay to ask a woman, you know, are you or have you ever been involved in sex work? They're not going to mind that question, but it's how you frame it and how you ask it that's really important. And if they say yes, then be curious and ask them what type of sex work, because that matters as well. You've seen from that list, there's so much that they could be doing, and knowing a bit about it can really help. I think being compassionate is really, really important for these women. They certainly the women that are street sex working, they exist in a really scary, violent, lonely world often. They don't have the same support mechanisms that lots of people have. The women that they're on the street with will be friends with one day and not the next, because they've stolen their phone, their drugs, their boyfriend. So showing some compassion can go a long way with these women.
Yeah, can I just in terms of risk for street sex workers, it felt like a really important fact that the kind of mortality rates for street sex workers are 6 times higher than the general population, and also their risk for murder is 18 times higher than the general population, and that is the kind of it's the most significant figures across any population group as well. So particularly street sex workers are really, really vulnerable, and just having some contact or an anchor point that they can go to, you know, that connection is really important.
Yeah, I agree. And I think the other thing that in the previous slide, a third of women who are sex working are on the streets, but 2/3 aren't, and they are the ones that, okay, they might not be visible, they might not be in Neep's End, and they might not be the ones that you know of as your complex vulnerable patients. They might be your mums or your students, and they're hidden, but they're doing this kind of work. So unless we're asking the right questions, we're not going to be picking up 2/3 of them and offering them the right service. So that's absolutely crucial.
Yeah, and I think again that thinking about clients who pop into my head. I've met students who are doing their masters and funding their masters through sex work. I've met public sector workers who are supporting their pay with sex work, and also just thinking about age ranges. So I've met women between the ages of 18 and early 60s. So again, just thinking about those assumptions and stereotypes, you know, anybody we meet could have been involved in some form of transactional sex, whether it's street sex work, a sugar arrangement, or some private arrangement as well.
So just rattling through the last few, because I know time's ticking. Being person-centred is key. So chuck quaff out the window. You're not going to tick any quaff boxes in a consultation with most of these women, so forget about it. But focus on what their priority is for that consultation, and it might not be health, it might be housing or benefits, or the fact they've just been beaten up. They may be drug seeking, but it definitely won't be what we think or want it to be. But it's about kind of addressing their needs, and then slowly, once we've gained their trust, kind of working on the more health-based stuff. They do make changes, so the asset-based approach is really important. You know, they do get off the street, and it might be off and on, but that happens. They might get off drugs and go on a script. They might get housed somewhere, and that can make a huge difference. So try and focus on the positive stuff and really kind of, you know, congratulate and encourage, because that can make a big difference. In terms of their rights, these women often don't get referred into secondary care or other services as much as other patients. I think sometimes that's because we just think, well, they're not going to go, they won't engage, but we don't know that until we try. And I think there are things we can do that can help them engage. When we're making a referral, we can make it clear in that referral that they may have extra needs, that they need a trauma-informed approach, that if they've got certain kind of difficulties or other people involved in their care that could be included in that referral, like a support worker, then we could be doing that. And I think it is up to us to try and help these women access the services rather than expect them to kind of be able to change and do that themselves. And as part of that referral thing, I suppose the re-traumatizing issue is really important. These women tell their story so many times and not always in a kind of a positive, in a way that helps them. And so if there's any way when we are referring into other services that we can highlight that that's not appropriate and it's not necessary, and we have a good account of what they've been through or what they're doing, we don't need to ask it at every point of referral into every service, then that can make quite a big difference. And again, it goes some way to them building trust and seeing that we are advocates for them and that we're on their side. Yeah, we talked a bit about safety for them. So violence against them is a really, really big issue, and creating spaces that feel safe for them is important. So a lot of our women won't access services where there are particularly other kind of complex, vulnerable males around, substance using and that type of thing. So SWAP is a women-only space, and some of the other services are also looking at developing similar kind of clinics and spaces for them. So I think that could make a real difference in terms of helping them access. And then lastly, promoting their empowerment and their agency and choice, because they often don't feel like they get very much of that, certainly within the health system, because we can be so rigid and often not patient-centred enough. So even the little things that we can do to promote their empowerment can make a really big difference. Okay, so I think we've got maybe 5 minutes left. And if anyone wants to put anything in the chat, again, sorry, we haven't got sound, so I'll stop screen sharing because I think we've come to the end. But if there's any questions in the chat or anything that you want to email either SWAP or Katie or I about afterwards, you're very, very welcome.
Any questions?
Doesn't look like there's any questions. The only thing I would say is SWAP is a really, really good resource. The girls down there are fantastic. So if you've got any questions or you've got someone that you're looking after that could do with some support, or you just want some resources or some training for your practice, anything like that, give them a shout. They'd be really up for getting involved. We're kind of all about just trying to increase awareness and improve the services.
So a question about exploring this more with women who haven't disclosed something but you think they might be involved. I suppose my personal approach would be to, if I'm asking something of somebody that I'm worried they might feel shamed or stigmatised about, I would give a range of options and say, if you're worried about somebody's risk, okay, so we understand that people who are in a vulnerable financial position might make different choices about how to survive, and this could be X, Y, or Z, and within that include sex work as an option, or having sex in exchange for food, money, other, so it's giving people that permission to then say. I'm just a little bit unsure about the risks to children part of that. I guess if it was around sexual activities in front of kids, that's a safeguarding issue, full stop, and the risks there depending on who they're involved in. But I think raising the issue, much as when we're talking about sexual health, it's not about assuming that people are just having one type of sex. It might be about going, people can have oral sex, vaginal sex, anal sex, which ones are relevant for you so that I can complete the right test. So I think given the rationale in that we want to support you in the right way, these might be the things that are relevant to you. Is it helpful to talk about that further? So I don't know if you've would have a different approach.
I think you're right. I think framing it in a, life's difficult for lots of people at the minute, and money is tight and people are doing all sorts of things, going to food banks more than they ever did. We know that people are using loan sharks and getting into debt, and really crippling debt, and that's increasing people getting exploited and drawn into criminal activities and that type of thing. So there's lots of kind of ways that we can frame it just to try and open up and then, as you say, just use that example of some people are having to kind of sell sex. Any other questions? I can't see anything else on the chat, so sorry if we've missed anything. No, we're all good. Well, thank you for your time. Thanks for coming, guys. Like I say, any questions, then drop us an email. We're happy to kind of give you any advice or help we can.